In the International Sports Med Journal, December 2013 issue, there was an article written by Korsten Ulrich, and he stated the higher energy turnover, which is achieved through physical activity, has a positive impact on the health of mother and child. Pregnancy is a special and important opportunity. However, along with the great joy and happiness that pregnancy brings, we also have a responsibility to create a healthy environment for the unborn baby and mother. One way that has been shown to better create a healthy mom and a healthy baby and an easier labor is weight training. However, there are tips and safety precautions that soon-to-be moms need to take so they do not overdo their bodies. Weight training regularly as a pregnant mom has many given blessings for the mom and baby-to-be. The first benefit I would like to touch on is stamina. This is created. Stamina through pregnancy not only is used on a daily basis, but it is important to have for labor and delivery. During labor and delivery, the stamina that can be created helps labor by focusing on natural movement to ease the labor. Weight training during pregnancy also helps to align the body easier in order to facilitate childbirth. Weight training also helps to increase the mobility of muscles that helps move labor naturally. The stamina formed also increases the ability to handle stress better, including the stress that comes with contractions. In an article by Wijen, Delamere Van Dewal, Mecklin, and Popil, found in the Clinical Endocrinology, January 2015, volume 82 issue, explains a relationship between moderate to vigorous intense physical activity and women after delivery. Throughout the research that was performed, it was concluded that those who maintained a regularly scheduled moderate to vigorous physical activity, such as weight training, had a significantly lower body mass index compared to those who did not participate in vigorous activity. There's also a relationship between physical activity and lower insulin levels during pregnancy. In a study, Resistant Training During Pregnancy, Safe and Effective Program Design, written and performed by Professor Brad Schofield, a health and science professor at Liam College and a specialist in exercise science, had concluded that strength training during pregnancy can reduce the possibility of gestational diabetes and how severe postpartum depression may be. He had also found the risk of preeclampsia during pregnancy had been reduced by 54%. Another benefit from weight training is having a healthier labor and delivery. Weight training has been seen to create a shorter labor and a shorter hospital stay. It has also been seen to have fewer complications during labor, as well as lowering the risk of going into preterm labor, and also have seen to lower perceived pains during labor. Weight training during pregnancy not only affects the mom, but also the baby. Soon-to-be moms that weight train give the benefit of higher APGAR score to their child. It also benefits the baby because weight training affects the baby's heart, and it tends to be less likely to restrict cardiovascular problems later in life. It also creates stronger blood vessels, matures the brain faster, and it also allows a baby to handle stress of labor better. Through Professor Schoenfield's research, he had concluded that those who have moderate to vigorous strength training while pregnant gave an extra blessing to the children. These children have been found to have a sharpened attentiveness and discipline. It had been concluded that this was possible by, quote, the ability of regular exercise to increase blood volume, cardiac output, and placental function, which in turn increases 24-hour nutrient delivery to the placenta, thereby improving fetal nourishment. Professor Brad Schoenfield. Even though body image should not be the #1 goal during pregnancy, it is an important factor in having a healthy mental state during pregnancy and also after delivery. In the same study done by Professor Brad Schoenfield, he concluded that those who remained physically active, moderate to vigorous exercises had a higher satisfaction with their bodies and more positive about the pregnancy-related changes. Along with benefits to both mom and baby during labor and delivery, weight training also helps to reduce back pain, knee pain, and the curbing back pain as the center of gravity changes to accommodate the growing baby bump. Along with knowing the benefits of weight training, it is also important to listen to these tips to maximize the benefits. First, it is important to consult with your midwife or doctor to make sure that the pregnancy is healthy and is not high risk, which may mean weight training may need to be more monitored. It is also important to consult with a personal trainer so that they can give you more of a personalized plan to follow while pregnant. While pregnant, it is important to avoid forceful exhale without release of air and also to avoid walking lunges. Weight training while pregnant, you should increase the reps and decrease the weight or use resistant bands, which are highly recommended. Also, skipping exercises that require laying flat and also that require standing up due to the change in center of gravity. Furthermore, try to rely and listen to your body and the needs it requires. Weight training can be a wonderful addition to your pregnancy regimen. There are so many added benefits to not only mommy, but also to the baby. If this at all interests you, make an appointment with your doctor. And if you are not pregnant, it is never too early or too late to start weight training.
Hooray!
Good job.
Thanks.